I was told that because I'm darker skinned, I need a lighter dose of the CO2 matrix laser for my scars. Is this true? Hi, I had laser resurfacing done on my face yesterday, and I'm afraid I might have gotten ripped off. I was told that because my skin is darker, I'm Latin but not really that dark, I needed to get a milder treatment, otherwise I would burn. I watched a lot of YouTube videos from people that have had it done, and on day 2 their faces were red and a little raw. I'm here on day 2, and it just feels and looks like I got a little too much sun, but that's it. Have I been ripped off? Help.
Thank you for your question. You submitted a single photo and you describe in your question that you had a matrix CO2 laser treatment done and that you're concerned that the treatment may not have been as deep as you would expect, and that you've done some research and you saw how many people were more raw or red after treatment, and in your situation, within about 2 days to 3 days, you only look like you're pink, or like you described having a little too much sun. And so you're asking if you got ripped off, and you were explaining in your question that because of your Latin background, that they stated that the doctor or the people who did the laser stated they needed to go light on you. So certainly I could understand your concerns. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic surgeon. I've been in practice for over 20 years in Manhattan and Long Island. I actually have been using the CO2 laser since 1995, and in my practice we have a similar laser, the Mixto fractional CO2 laser. And so I can certainly give you my experience and how I approach situations like yours, and give you a little bit of guidance as to what your physician may have been thinking in terms of your treatment. So to understand a little bit about lasers, first we have to understand what are the problems we're trying to solve. You know, the term laser is very often used and abused, and it is unfortunately perceived as high-tech and as a method to erase everything you don't like. However, when you really understand what a laser is, it's a conversion of light energy into heat. And with lasers, there are basically 3 targets. There's water, there's blood, or red, and there's pigment, or brown. CO2 laser has been around since the mid-90s and was first very aggressive. And when I say aggressive, basically we were ablating the top layers of skin very aggressively to restore new skin that would be smoother. Now at that time, people with any tendency to tan easily would not be treated with this laser because of the fear of pigmentation. Now move the clock forward, give or take 15 to 20 years, fractional CO2 laser came to the market, and for me it's been a great tool because essentially I was getting the best of both worlds. The depth and thermal energy delivery that I want with the CO2 laser, but with less downtime because of the fractional delivery. Now, when people like yourself come to my practice, what I do is first talk to them. What are they trying to do? Are they trying to improve pigmentation? Are they trying to improve fine lines? Are they trying to refresh their skin? And are we dealing with something more involved, like acne scars? So my approach, especially with people who have darker skin, is to be conservative, but I don't usually use a CO2 laser as my first line of treatment. What we do in our practice is we tend to use a lot of platelet-rich plasma. Now this development, platelet-rich plasma, just for a brief overview, is a concentration of the growth factors and healing factors from your blood. And when injected into the skin at with a certain way and a certain level, we're able to actually improve pigmentation in people who are at risk of hyperpigmentation from thermal devices. So I think that one issue that you may have is you may not have had gotten a clear understanding of a full treatment plan. When I talk to patients about treatment, when it comes to skin, it's rarely ever a one-off or a single treatment and they're good forever. A lot of times it has to be a plan as well as a strategy. So with someone like yourself, I can understand why they were being conservative because they're concerned about the issues we have with anybody with pigment, which is hyperpigmentation or hypopigmentation. Too much pigment, too little pigment, neither of which is very good. Now, it could be that your doctor wanted to do a limited test to see how you would respond. I think it's a very, very tricky thing to use thermal devices on people with darker skin, and that may be the basis of why you look like you do at this point. I would not say that you, quote, got ripped off, but I think that what you were clearly in need of is an understanding as to the plan and the expectations. CO2 laser delivers energy in a fractionated way to the deeper levels of skin. The benefits of that can go on for months to a year. That's what it takes to get the full benefit. So, although you may not be raw, you have to understand that at the deeper levels of skin, the collagen remodeling part that occurs at the dermis level, that is still ongoing. A lot of times for my patients, what I'll do is I will do platelet-rich plasma treatment first, and then I would do a very limited and light laser for just the top layers of skin. I tend to be much more conservative when it comes to darker skin. A lot of people come to me because they have darker skin and they've been frustrated with going from one laser to another to try to treat acne scars and fine lines. And although a lot of these lasers, including the fractional CO2 laser, are considered safe for dark skin, it doesn't in any way mean that that these modalities are not free of complications or undesirable results such as pigmentation issues. So, understanding that, I think that you should allow for the full healing of your skin. Talk to your doctor about what your goals are and what you want to see as an outcome. It might be that your doctor suggested that this laser would be the one and only thing you need. I see this all the time, particularly patients who come in for acne scars. I always tell them that acne scar treatment requires a lot more complicated, or I should say, a lot of different levels of treatment that is not just going to happen with one laser treatment. But that being said, if you were looking for, you have to define for your doctor. Are you looking for pigmentation improvement, skin glow improvement, textural improvement, fine line and wrinkles, acne scars? The more clear you are, and you have to see what can your doctor offer you. It's very important. I feel like in our practice, what we do is we develop relationships with our patients, and we have a plan, and I'm very straightforward with them. I tell them if they're going to only do one thing, just don't do anything. If I'm recommending that a procedure for optimal result requires 2 to 4 treatments, there is no value in doing just this one-off approach. I think it's important that you not just bounce from doctor to doctor. Find someone that you like and you trust and understand what the limitations are. Every procedure has risks, benefits, and other options, and that's what informed consent is about. So this is something that you probably should revisit with your doctor. So I hope that was helpful. I wish you the best of luck, and thank you for your question.